This is Dr. Patrick Burnett. This quick tutorial is going to go over the assignment for the Public Health Finance text, the tutorial Module 2 about costs and margins. Now, much of this material is already covered in the regular text, the Chapter 4 there. So what you see here in this chapter is a more public health focused look at how costs and profits, or what they call margins, are viewed in public health organizations. Now, just to give you orientation, we're on page 6 here, and questions 1 and 2. And to find those answers, you can look up a little bit where it starts talking about fixed versus variable costs. And you'll see one of the most important things is this definition of relevant range. And that just means that you try to scale your organization to the level of output. If you're in a small rural area and your occupancy averages 200, there's really no sense in considering a scaled up hospital for 1,000 because it would never be even close to half full. And then talk about the difference between fixed, and you can see right here the question marks right there, between fixed and variable right there. One of the easiest ways to visualize this is to think of a parking lot. Parking lot is kind of fixed. It's something you can't change the size of your parking lot in the short run, especially not if you think of a big structure sitting next to a hospital. So at least in the short run, you might think of that parking lot as a fixed cost because it can't go up and down based on your patient load or, as we were talking about earlier, your occupancy. However, there are things that are variable, such as the number of nurse hours. Those can be easily scaled up or down depending upon occupancy. Now, some clever companies will lease out, you can see right there, things that were considered fixed, like diagnostic equipment. Some companies will lease them out. Literally, they can come on a truck and sit in your parking lot for, let's say, 1 or 2 days a week, depending on how much you need it. So what that company's done is they've converted something that's normally thought of as a fixed cost, a big piece of equipment, into something that's more variable. Now, this chapter talks through a cost behavior illustration, looking at how fixed and variable and total and your average costs per unit all change over the volume. And this is where I invite you to go over to chapter 4 and look at a detailed example that shows how to do that in Excel. Now, the next set of questions deal a lot with what they call cost allocation. And to get a good feel for that, it's good to start with something that they call mission critical tasks, which is, these are the things that make you what you are. A hospital is about treating patients, diagnosing, and let's say dealing with emergencies. If you're not doing these things, you're kind of not a hospital. But like any company, there's a ton of support activities that these core business things, these mission critical things, need. Everybody needs billing because somebody has to pay for everything else. Everybody needs administration, and everybody needs a parking lot. Parking. These are all good examples of typical support activities. In other words, being a hospital, you have to do these things here. Now, most of your support activities are required, but they're more generic. Also, they apply to multiple different departments. Here, billing supports patient treatment, supports diagnosis, and supports emergencies. Admin, your managers run the whole place. And parking, people from all these departments, your employees from all these departments, deal with your parking lot. So the goal of cost cost allocation is to take the costs here and decide how much goes to patient treatment, how much goes to diagnostics, and how much goes to emergencies. Now, when you're trying to take these support activities, one of the things to consider when you're trying to divide them up is to determine whether or not there are different types of activities even within there. So in the billing department, for example, there is typically the outbound bill, which we'll call just billing, but then there's also the collection part of it, which can be more time consuming. And for example, while most of your patient treatment bills probably require a little collection effort because most of those are insured, some of your more of your emergencies might need more collection help because some people are uninsured.